Hey guys, so the topic that I chose for this discussion is hypothermia, care for hypothermia. The reason why I chose hypothermia is because I kind of never knew how to care for the body when the body's initial temperature drops so low that it causes death and severe health issues. So that's another reason as to why I picked hypothermia. And I also want to be able to care for people who do have hypothermia. Like, say, if I go to Alaska, or I'm on a cruise, or I'm going fishing and the boat ends up breaking down and we got to be in the water for a long period of time before help comes. Or if, like, I got hit by another boat in the water and we are in the middle of nowhere and we have to basically either care for ourselves or wait until care gets there. So I kind of want to have a better understanding as to how I can help myself and how I can help others that may be having hypothermia. Now, some main things that you want to look for in a person who does have hypothermia, the signs and symptoms you're going to want to look for is shivering, numbness, glassy stare, decreasing level of consciousness, weakness, impaired judgment, changes in level of consciousness, and unresponsiveness. Those are the main signs and symptoms that we want to look for because, like I mentioned before, hypothermia is a leading cause to death. Now, a way you want to care for somebody who has hypothermia, the first thing you're going to want to do in all cares, you're going to want to first call 911. You're going to want to call 911. The second thing you're going to want to do is, in some severe cases, you're going to want to prepare yourself to give CPR as the breathing may cease. So some people may have, if they can't swim or if they can't be in a water for a long period of time, or their body isn't used to being in such cold water, they're gonna end up having difficulty breathing because it's so cold. Like, when you're shivering, like, even when you're shivering, you still have a little issue breathing because you're so cold and you're trying to warm your body up at the same time. The third thing you're gonna want to do is remove all wet clothing. And when removing wet clothing, make sure you have a set of dry clothing. So as soon as that person takes the wet clothing off, you're able to put on the dry clothing. Now, the fourth thing you're going to want to do is wrap the person in a blanket, towel, a plastic blanket, or a plastic, I don't know what it's called, but it's like if you see in like nurse shows or doctor shows, they always have somebody who's super duper duper cold. They have them wrapped up in this plastic, like, extra blanket for it keeps you very, very warm. And then you're gonna also want to cover the head to make sure that every inch of the body is being prepared to warm up again. Now, the fifth thing you're gonna want to do is position the person by a heating source, or apply heating patches. Now, another reason why you would do this on top of having the blankets and on top of having the dry clothes is to just make sure that the body is really getting itself warmed up again, as it has been in cold water for a long period of time. So you're going to want to prepare the body to be warm again. Now, the next thing you're going to want to do is give warm water, not hot water, but warm water. And it cannot contain alcohol or coffee. Now, the reason why you'd give warm water, again, as to why you would also just give the list of warm items, is to just prepare the body, the mind, and everything like that to be warm again. You must not, do not put the person in warm or hot water. Do not do it, as it may result into shock. So don't put the person into hot or warm water. The next thing you're gonna not want to do is rub or massage extremities. So do not rub or massage the person's body that's been in the cold body of water for a long period of time. Do not do it because it can really damage a lot of things within the person that we may not see, but they could feel. So do not massage the person. Do not let them go into warm water. It may be a thought in their head like, oh my God, I just want to be in a warm water. I want to take a warm bath. No, you have to warm that body up first before doing anything, because immediately putting that person into warm water or hot water or immediately rubbing that person can cause serious damage and may even cause death. So do not do that. And that is really why I chose the topic hypothermia. It's very interesting to see how the body may react to such cold water and how the body's temperature drops so low to the point where it causes death. Like, I feel like this is also another topic that not a lot of people take seriously, or not a lot of people really know that this does happen. If you decide to be an EMT or work in the hospital, like, you'd be very surprised of how many people come in with hypothermia. I feel like it's a very common case that happens. Like, some people don't know how to swim and they're caught up in cold water for a long period of time. They can't swim, they're also drowning, causes death. Somebody that knows how to swim but is in a big body of water for a long period of time that's super duper cold, of course the body's gonna get hypothermia. Like the Titanic, for example. You see how the water was so cold that almost everybody ended up dying because the water was so cold and they couldn't keep their bodies warm anymore. They didn't have a place to call for help. They didn't have anybody. They didn't have anything. They didn't have warm clothes to change into. The boat was gone. So they really had nothing. Or I should say the ship was gone, so they really had nothing. So that's really why I chose the topic hypothermia.